you try to get people out of comas. From what I've heard from Jay, that's not a fun business to be in. Could you get
No.
into that a little bit?
Yeah, I took the coma training in Europe and in the United States and began to become a leader of coma teams in Minneapolis. And I worked on several different coma teams. And we are not always successful. Patients do die. We lose them. We don't kill them, but they do die. It's serious business. It's not what the average chiropractor does. I led a team of interns and doctors in Minneapolis, and I've had lots of failures. You don't do serious work and not fail. And I think it's really important for people to understand that I make mistakes every day, but it's because I dared to make a hypothesis about what is wrong with the patient. And I might make 8 or 9 hypotheses about one patient, and I'll find that 2 or 3 of them are wrong. But the process of being a clinician is to test those hypotheses and say, that's wrong. But it takes several weeks or months to figure out that it's wrong because you use a clinical trial to figure out that it's wrong. And that's what clinicians are supposed to do. Now, researchers don't like that. They go nuts because they say, oh, it's unsafe and it's dangerous and it doesn't give you the truth. And I say, yes, yes, yes. But I have an ethical obligation as a clinician to really pay attention to trying to get the patient better and make a hypothesis about what is wrong with them because we don't know everything.
Now, the difference between Jay did and what you're doing, Mike, I think Jay, you worked with veterans who got pretty pissed at you when you brought them out, and I don't
Yeah,
know.
we we woke up 27 out of 33 who had been in a coma over a year with a Glasgow coma scale less than 8, which basically means there's been no reaction to anything, pain, sound, whatever. They're just not responsive at all. And that's what a layperson might consider a full coma, as opposed to like um, locked in. Some people know what locked in syndrome is, or a kind of a light coma where they respond to touch or something. These people are just a slab of people. They're just they're not there. And um, uh, 27 were brought out. The process was a brutal process. We don't tickle your feet with feathers and whisper in your ear, "Wake up." That doesn't work. Somebody else already tried that kind of stuff, and we're unsuccessful. So Kessler Hospital in New Jersey would allow the study. It was difficult to get the IRB approval because what's informed consent when the patient's in a coma? And if you ask the family, sign here and I'll wake up your grandma, I mean, that's, coercive consent, and that's not real consent. And if you go ahead and assume, okay, if your second cousin says okay, then now it's okay, and it's ethical, you're deluding yourself. But let's say you think it's a fine thing to do. Well, when you wake up 27 people and a third of them are really quite upset with the process having been brought back, they're not happy to be back. Most of them don't really remember the process of coming back. That they're treated with medication for a few weeks to excite excitatory chemistry and extinguish inhibitory chemistry, so that if the nervous system gets an input, it's going to have a big reaction. And then we strap stimulators on the hands and feet and turn them up to a point of ridiculous level of stimulation. A median nerve stimulator, you get a little twitch in the thumb. That's a good response. If you turn it up too much, you might get the hand to twitch a little bit. If you turn it way up, you get the whole arm jerking. Well, both feet, both arms are jerking around. It looks like the person's having a convulsion on the table with the stimulation. If you look, you get a 40% increase in brain metabolism from all of that, which is kind of what the reason to do it is. You're trying to stimulate the brain into being active. And most of them woke up during that. There were some that woke up with a C2 stimulation, which is C2 is basically the top of the spine at the back of the neck. And the C2 stimulation goes directly into the brain. Kind of like having a cattle prod stuck into your brainstem. And these are aggressive attempts at waking people up. When they come to, they're usually vocal, not yelling "thank you," but more like "f you," and yes, swearing and screaming, but they don't really remember that very much. That's all cloudy and kind of fades out of their conscious awareness after they're back. But the ones that are back and solidly back, if you could predict which ones were going to be upset, it'd be an easy thing. Oh, yeah, he's missing both arms, and he's not going to be a happy camper if he comes back. Well, people with really severe physical problems like that were just as happy as a lark to be back. So you can't look at him and go, oh, well, yeah, he's a real mess. I don't know if we can bring him back and have him happy, because being a real mess didn't predict unhappiness. One fellow had lost IQ points, and he was normal. It wasn't like he was a stupid person in the state that he came back in. He was conversational, as a relatively normal level of intelligence. But he had been awfully sharp, and the loss of his, I guess, sense of self of being the bright guy, somehow that was more than he could take, and he attempted to do himself in repeatedly. So, I can do other things. We just showed that it was possible, that the technical possibility, the feasibility of coma recovery, and it's entirely feasible. It's relatively effective, and in fact, in one circumstance, not in that study, but in one circumstance, there was the use of the technique, not waiting for a year and getting an IRB approval and all of that. But if you remember, there was a mine that collapsed, and all the miners kind of sequestered themselves in they taped off an area, trying to keep all the good air in, and they made it quite a long time. There were a lot of them in there, but when they finally got to him, there was only one person left alive, and he was in a coma. They scooped him up, ran him to the little local hospital. Sega Mine, the Sega Mine group brought in this group from New Jersey. They woke this guy up in a day, and well, he wasn't as far gone. I mean, there were still some crude reactions and things still there. I mean, he was more present than the people that had a Glasgow Coma Scale less than 8 for over a year. So he popped back, and he was conversational. You could tell he was a little, I don't know, it wasn't just shell shock of having been back. He was a little stunned, sort of, in his presentations. So I think going over and coming back is quite the experience. So being a bit stunned, I can understand myself, having been over and back a few times. So the first few, you're a bit like the deer in the headlights when you come back. So